Okay, class. For my critical assignment presentation, I chose to do it on a low fat diet versus a low carbohydrate diet, and what are their effects on body fat percentage. Okay, so just a little background information on both diets. A low fat diet consists of reducing the amount of fat intake throughout your diet. This could be getting like a reduced fat in any dairy products. Um, and then a low carbohydrate diet does consist of avoiding any foods that are high in carbohydrates, like say bread or pastas. Okay, so these diets have been shown to have helped individuals with weight loss and loss of body fat. And so with these certain diets, such as the low carbohydrate and low fat diets, um, these are the most like popular ones that have been linked to show these type of results. Okay. So continuing on with the introduction, the reason why this subject is important is because obesity and cardiovascular diseases have become a greater issue in the U.S. now more than ever. So a way to help predict these diseases or help reduce the chances of getting one of these diseases is knowing the body fat percentage. Um, no, and diets are known to having an effect on body fat. So these can help individuals who are having these issues. And so why why we chose to do this study was because there was little to no research on knowing the exact effects of the low carbohydrate versus low fat diet on body fat percentage. So expanding this research could help in the future. Okay. So the problem statement, my research question was, what is the exact effect of a low fat diet versus a low carbohydrate diet on body fat percentage? And so for my hypothesis, it is a low carbohydrate diet will contribute to a greater decrease in body fat percentage than a low fat diet would. And we'll see if that happens. Okay. So for the methods section, um, the participants, they consisted of 20 individuals. And so these individuals were between the ages of 30 to 50 years old. And so these individuals were also chosen by a simple random sampling. And they were chosen by a list that was obtained by a local health department. That is how they were contacted. And so the health status of these participants were also examined, and they were examined by a survey. And this was done because knowing the pre-existing health conditions, um, it could have had an effect on the study. And so for the procedures part, the participants were randomly assigned to two groups. These two groups were either a low-fat diet group or the low-carbohydrate diet group. And they were also instructed not to change any of their normal physical activity. They were encouraged to keep on doing their normal activities they would do. And they were also instructed to follow their specific diet for 3 months. And so the way that their body fat percentage was measured was measured by using the DEXA scan. This scan was an X-ray scan that would measure their body fat and their muscle and bone tissue. It was done at the baseline and at the end of the 3-month study. So for the methods continuation, there's statistical analysis or test. Since the study was done using a pre and post results, a gain score was conducted, and it was conducted to compare the effects of a low fat diet and a low carbohydrate diet on body fat percentage. And the alpha was set at 0.5, meaning the differences that were considered statistically significant was if the p-value is less than 0.5. Okay. So for my results and findings, the low carbohydrate group had an average height of 167.4 centimeters with a standard deviation of 11.3, and their average weight was at 78 kilograms with a standard deviation of 10.6. And the low fat group had an average height of 172.1 kilograms with a standard deviation of 9.9. And then the average weight for this group was at 73.5 kilograms with a standard deviation of 12.6. And so again, the gain score analysis was conducted, and it was conducted to compare both of the differences in body fat percentage over the 3-month period. And then after the gain score analysis was conducted, it was founded that there was both on both of the groups there was a decrease in body fat percentage, but the low carbohydrate group had a significantly greater one than the low fat group did. And so for the low carbohydrate group, their mean score was at a negative 0.602, and then the low fat group had a mean score of negative 1.302. Okay. Okay, so for the discussion part, so the purpose of why this was studied was it was to investigate the effect of a low fat diet versus a low carbohydrate diet and their effects on body fat percentage. And after doing this study, the findings were that both of the diets did experience a reduction in their body fat percentage. However, the low carbohydrate group did experience a higher loss of body fat percentage over the 3 months. The study is important, and it is relevant for today as well, because again, diseases such as obesity and cardiovascular are important, and there are individuals looking out there looking for a specific diet to follow to help lower their body fat percentage, and this can help individuals with living a healthier, longer life. Okay, and that is it. And thank you.